Namaste. My name is Dr. Angirash Bhattacharyya. I am a consultant neurosurgeon in Name Care Hospitals Guwahati and Name Care Hospitals Tezpur. Today, we are here to discuss some common myths and things surrounding epilepsy, and we caption it as "Live Beyond Epilepsy." The most common question that surfaces in any person is that what is epilepsy and how do we know that we have epilepsy? So, to be very frank and to be very basic, considering my audience to be anyone present, epilepsy is nothing but an abnormal misfire of the neurotransmission. In very simple language, brain is made up of numerous millions of minor structures called neurons, and we have chemical messengers. Whenever there is a misfire, we call it an seizure. And when we have multiple seizures, we say it to be an epilepsy disorder. Now, how can we know? No one generally knows until we have an acute episode of seizure. A seizure is nothing but, again, I would say, an abnormal impulse transmission of the brain. It is a sudden episodic movements of the body that makes the people surrounding it very anxious. But at the end of the day, when the patient is taken to a doctor and we see it clinically, we diagnose it to be a seizure. And if a person has multiple such episodes, we tag it as an epilepsy disorder. Coming to a very important thing that my patients comes on and asks me is, "Well, once I am diagnosed, sir, what to do?" The thing is that once you are diagnosed, you should always be in a checkup and a follow-up with a doctor, a neurologist or a neurosurgeon who gives you medication regarding it, and avoid the trigger factors. Now, what I mean by the trigger factors, there are various trigger factors to seizure. Now, the most common being sleep deprivation. The sleep deprivation or excessive stress is one of the most common triggers that the patient says that after a sleepless night, they suddenly don't have epilepsy for 1 year and then suddenly have a seizure episode. Other things are sometimes alcohol is also a trigger factor, fever is another trigger factor, and sometimes sudden light coming to the eyes, that is also a trigger factor. There is subjective thing, more of a thing, but there one common thing that everybody complains is that patients normally has sleeplessness as a trigger factor to epilepsy. Now, then again, people come and ask me what are the most common things that I as a caregiver should give, as a layman should give whenever I see a patient having a seizure. Most important thing that I will always like to mention is we should not panic. Whenever you see a seizure around, you should not just panic. First, always remember seizure is not something very permanent. It is an episodic thing and it will just last for a few time and it will just disappear. Within that period, you just need to avoid the patient from getting any injury. For that, do not enter any spoon in the mouth, do not enter anything in the mouth, do not ask him to smell some socks or slippers. That is something a very big myth going around. You avoid the patient from getting injury and reassure him, and one of you just check the time for how long is suggest. When you come to a doctor, this time also gives an idea what type of seizure it is. Also, what the patient was doing before the seizure, what was happening within the seizure, and what the patient says after the seizure. Many a times we see that there was a pre-seizure aura and there was also a post-ictal, that is post-seizure confusion. That is very common. So if you can make a video of it, it is very helpful to the doctor who treats you. Coming to the next common question that people comes around is that what is the treatment procedure? Yes, and one people also ask, can I be completely cured from epilepsy or seizure disorder? Here, the word cure is very much synonymous with control. We can always control seizure with proper medication, and we can also say that if a patient don't have a seizure for 10 years or a patient is without seizure for 5 years without medication, then I think that we can consider it to be a complete cure from seizure. And the treatment protocol mainly consists of that is anti-epileptic drugs. That is various kinds. We normally need to take a single dose or a double dose for a long period of time. And apart from them, a very intractable seizures that is not controlled by medications, we go for surgeries as well. Along with that, there are some other type of medications like the vagus nerve stimulation, the ketogenic diet, a form of diet where we like to burn less of carbohydrates, more of fats, and produce ketone bodies. We also tell the patients to a great extent to have a lifestyle modification. This conglomerate the entire spectrum of anti-seizure treatment. And the one thing that I would always like to highlight is that lifestyle modification, and not only the patient but also the patient around and the people around the patient has a very great role in treating epilepsy. We need to make the patient feel that he is just like any other people. He is not a specially able person, or he is not a person having with disabilities. Seizure or epilepsy is never ever a disability. We need to reassure and reinforce the thing in the mind of the patients that they are just like normal any other. We need to have a very good environment around the patient, so that he has that self confidence and to feel that just not an abnormal person. Also, many of the people also come to me with the questions: is there any non medication things that we always like to reinforce while patient having seizure? I would always like to say that lifestyle modification is always a cornerstone for this. We need to go for things like relaxation, yoga, and many other things, just like listening to good soft music. This all gives your mind some rest and some positivity. This surfaces around the patient feels that something positive around him. He should always take precautions that he is not exposed to very high light or any loud sounds which might trigger. He should always take some precautions while driving, doing some activities in very high places, or any some active works. He should always take some precautions. The rest of the thing he can take normal life. One more question that I my patients ask is that, can patients with epilepsy go for a marriage and have children? Definitely they can go for a marriage and have children. But there are some literatures that some anti-epileptic drugs decrease fertility in man and female. In that scenario, we should always keep in mind that we need to have a constant association with a neurologist or a neurosurgeon and a proper gynecologist, so that we can have a preconceptual counseling before we are going for planning of pregnancy. We have a proper antenatal care and proper postpartum care, that is care after delivery. That is very important. But with proper medications and proper support, you can definitely have family planning. Now, conglomerating everything and coming up to a point where we can have an overview. I have discussed what is epilepsy. I have also discussed the things and the myths surrounding it. We should never try to put anything in the mouth when the patient is having epilepsy, like slippers, like socks and spoons. We should always try to reinforce it and consider it to be an episodic thing that will go after some time, and reassure the patients to get proper medication. Concluding it, I will come to some points, some do's and don'ts. First, one person can do, a person with epilepsy is just like any other person. He can raise children. He can become a father or a mother. There is no limitation to his works, and he should not be treated as any person who is having any disability or any problem with his that he is surfacing. He is just like normal person who is having leading his normal life with some help from a proper caregiver. He should never be debarred from dreaming. He should never be debarred from going for his aims and objectives in life. He should always be given proper envelope with proper care. And for that, we doctors are always there to help you. And we always say that with proper empathy and not sympathy, we can definitely live beyond epilepsy. Thank you so much for your precious time.